Hello everyone and welcome to the 2021 Annual Clinical Assembly. My name is Lucas Kerr. I'm a pre-med student who's doing rotations in New Mexico, and I worked with Dr. Reedy to put this presentation together.
This is Dr. Kristen Reedy. I'm an assistant professor for the Burrell College of Osteopathic Medicine in Las Cruces, New Mexico, and a practicing general ophthalmologist in Santa Fe. We will be presenting data that we have collated from more than 5,000 patient visits from 3 of our glaucoma providers at one of our offices in New Mexico. We chose to analyze the glaucoma patients in an effort to better serve our patients in the future come another pandemic or resurgences and recurrences of COVID-19.
These are our references. And we have no disclosures to make. And like Dr. Reedy said, today we'll be talking to you about how COVID impacted glaucoma patient visits in Santa Fe, New Mexico.
We were motivated to investigate this for many reasons, mostly in the interest of patient care. I thought we'd be remiss not to investigate it. We think that every year we do better and better with glaucoma care, but it is still the leading cause of irreversible blindness, and by 2040 it's predicted that there will be almost 112 million cases worldwide. I'm sure that your practice patterns are similar to ours, and your glaucoma patients are also similar to ours. We see our glaucoma stable patients every 4 to 6 months and perform visual field and OCT evaluation of the nerve fiber layer at least once a year. We feared that without regular visits during the pandemic clinic unavailability, without regular visits encouraging patients to be compliant and seeing them to refill their medications, that we would have unnecessary disease progression.
And before we get into our data, I'd like to give you all a brief overview of how COVID impacted New Mexico and go over some important dates. So on March 11th, New Mexico saw its first COVID case. Shortly after that, on March 19th, we stopped seeing routine patients, including stable glaucoma patients, here at Eye Associates. In March 23rd, we stopped all non-essential businesses in New Mexico. Shortly after that, all non-essential healthcare services were restricted. And it's worth mentioning that while we didn't reach a peak in COVID cases until November, patient fear and confusion was probably at its height in the earlier phase of COVID around March and April. And we saw our highest positive cases in one day on November 19th at 3,665 cases. It's noted here with the red arrow. And then after that, in early December, the governor of New Mexico instituted a color-coded system that set regulations for different counties based on how many positive COVID cases they were seeing. In February, Santa Fe County went from red to yellow. Then shortly after that, we went to green, and not long after that, we went to turquoise, which had the lowest restrictions because we had a low enough COVID count.
One thing that I'd like to emphasize that in the first months, obviously here and elsewhere, things were understandably frantic, scary for patients. None of us had enough information with regard to glaucoma care, and both doctors and technicians were out in the parking lot checking pressures in patients' cars using handheld tonopens. In New Mexico, I feel that we were blessed with a more delayed arrival of COVID, and with our smaller and more geographically distributed patient population base, we did not have early spike. It really didn't spike until December. Many of your patient data curves and COVID infection rates will be worse than ours was. Also helping us was that the New Mexico's political climate and the agreeability to wear masks and share PPE with the hospital really set the stage for a cooperative effort. Next, we'll get into our office data. We obtained just over 5,000 patient records for a 2-year period of time, beginning in January of 2019, going until December of 2020. You can see that in 2019 we had a very stable patient visit graph. We had about 275 glaucoma visits per month for the entire year of 2019. Around the holidays, late in the year, we did have an expected dip, both with the doctors being out and patients not coming in around the holidays. In January, we saw quite a rise, and we were fixing and anticipating having a very busy clinic year with regard to these numbers. This was reflected in our diabetic population, cataract population as well. However, then COVID hit, and you can see this devastating plunge really from January all the way down to March. Actually to May. From May climbing up to July, we were able to ensure our patients that their visits would be safe, and we got back almost to our pre-COVID levels very quickly. However, come September, we had another dip, and this was a little puzzling to us, but in a graph representation like this, quite obvious that the bottleneck to care, both with physician clinic availability and lab visual field and OCT availability, we could not meet the demand. This happened 6 months from our greatest dip, and so we do expect to have these cyclical dips every 4 to 6 months, as that was the time frame for the patients that we did not follow up with in February, March, and April.
To see how COVID impacted our patients here, we looked at the total number of patients, the total visits, and the average visit per patient ratio in both 2019 and 2020. And as you know, 2019, we did not have the COVID pandemic, so this was just setting the baseline for an average year here. And in 2019, we had about 1,482 total patients, 3,109 total visits, and about 2 visits per patient. In 2020, we saw a 15% decrease in total patients to 1,255, and a 31% decrease in total visits to 2,139, as well as 1.7 visits per patient. So what we're looking at is not only fewer patients, but fewer visits per patient in 2019.
Definitely a large percentage of our glaucoma patients went without care for those months. The next graph superimposes the 2019 dark blue line and that patient data with the magenta data. And you can really see a better representation of the loss of follow-ups from February to April, and then the steady climb from April up to July. We acknowledge that the demand for glaucoma visits, especially in the lab, could have been alleviated by better staffing, and that had we done that, we probably could have reached 400 visits in that period of time after our lowest dip. Definitely something to consider in the future should we have another resurgence or another pandemic. So what can we learn from our COVID experience? What can we learn from physicians learn from our patients' behavior and also our patient clinic behavior? Did our glaucoma patients start coming back? Can we be better prepared for another pandemic? And then are glaucoma patients representative of other patients with chronic diseases like hypertension and diabetes? As vaccinations become more commonplace, and more patients appear to be attempting to return in 2021, we suspect that the data here from Santa Fe will help us better strategize in our other offices to take care of our glaucoma patients as well as our other patients.
So to summarize, glaucoma is a treatable disease and it has good outcomes if patients come back for testing and follow-ups. And in 2020, we saw both fewer patients and fewer visits, which likely contributed to unnecessary progression of glaucoma.
In the future, we'll be better prepared, we'll have better outreach, and we'll be better prepared. I think that bolstering appointment availability, both in having our glaucoma physicians avoid being out during cyclical 6-month intervals, and maybe upstaffing both our lab and our clinics for glaucoma patients in the future will mitigate the poor glaucoma follow-up that we saw in this analysis. Thanks for allowing us to share this data with you. And special thanks to Kate Dwyer, our database analysis analyst who helped us pull this together, and Dana Golden from patient accounting and our coding compliance specialist who was instrumental in getting these figures together. Thank you and enjoy the ACA.